physical therapist today. We're going to be measuring your hip flexion range of motion passively.
Okay.
So if you'll lay on your back.
So the patient starts out in supine, and she's going to be moving her right hip in the sagittal plane. The therapist first does it himself passively to get a baseline feel, check for any abnormalities, and to feel the soft end feel.
So if you'll do that by yourself.
Second, the patient does it actively, so he can check for compensations and other abnormalities. Next, the therapist is going to get the resting flexion measurement by placing the axis of the goniometer on her greater trochanter, the movable arm on the midline of her femur, and the stationary arm at the midline of her pelvis.
About 10 degrees of flexion and resting.
Okay. So now the therapist is going to move it himself. He's going to place his thumb on her ASIS to check for posterior tilt of the pelvis. Once he feels the posterior tilt and that soft end feel, he'll know that he's at her full range. Again, he finds the greater trochanter and lines the axis of that goniometer up with the greater trochanter, the movable arm on the midline of her femur shaft, and the stationary arm at the midline of her pelvis.
About 115 degrees.
Which is a little bit short of what's normal, which is about 120. Thank you.